Hi, my name is Dr. Sharda Lakhani, and I'm a consultant clinical psychologist at Walsall Healthcare NHS Trust. Today I'm talking about anxieties and fears of recurrence. Knowing that these are some of the most common fears that cancer patients will struggle with post-diagnosis. And historically, pre-pandemic, we would have done this in a group setting so that we could support all of you. It doesn't matter which cancer site you're from, which cancer diagnosis you have, which stage of illness you're at, because anxieties and fears of recurrence are common to all patients post-diagnosis. And this is why we would have delivered this talk in a group setting. Knowing that we're in this very different world now, we've not able to have those groups for a long time now. So I thought I would record this for you so that at least you're receiving some support, knowing that you are not alone. Anxieties and fears of recurrence are common to all post-diagnosis. So knowing that we would have done this in a group setting, my first question would have been in a group, is there anyone in this room who doesn't have anxieties or fears of recurrence? Knowing that we've been delivering these groups for over a decade now, never have I seen a hand go up. So this is really to normalise that the anxieties you are going through, the fears of recurrence are absolutely normal post a cancer diagnosis. So what is anxiety? Would be my first question. Some of you may know what anxiety is, some of you may not. So I will go through this quite formally. And thinking about whether cancer, post-cancer anxiety is normal. Absolutely, it is normal. Because now that you have been diagnosed, your mind's eye is seeking out threats of all sorts. Knowing that a formal definition of anxiety is a feeling of worry or nervousness and uneasiness about something that has an uncertain outcome. Post-diagnosis, post-treatment, majority of patients are wanting a definitive cured. You're all cured. That is something that the profession in oncology and palliative care just does not use. Remission is as best as it gets. This is the formal new norm of cured. Remission means that you are being supported, monitored throughout, not just through your treatments, but also post. So you will have follow-ups, but also knowing that you've had a cancer diagnosis, this is something your GP will absolutely be on top of now, as you may have completed your treatments in the acute trust. So anxieties are absolutely normal post a cancer diagnosis. Again, some of you may know historically where anxiety comes from. If I give you a quick whistle-stop tour of what anxiety is something that every single human being has. It's just that it gets such bad rap, it's got a stigma attached to it. And it's actually our safety mechanism. So in terms of that quick whistle-stop tour, imagine prehistoric days, we're living in our caves. All of us are living in our caves knowing that we are hunter-gatherers. We have to go out to get our food. You have a very, very quick thinking brain that suggests that if I go outside from my cave, I may be attacked by saber-toothed tiger, by dinosaurs, beasts of all sorts. So your brain has to get into a very quick state of alertness to either fight as hard as you can or fly, run as fast as you can. The third alternative is freeze. Freeze is not a good option because you'd be dead meat to the beast anyway. So your brain says, right, I have to run as fast as I can or fight as hard as I can. Both of these physiologically, fight and flight, instigate the same physiological reaction. So your heart pounds 10 to a dozen, clenched fists, so all your body, all your blood is being pumped to your heart, which is why your heart is racing 10 to a dozen. Your body is quite basic in thinking that only your heart as an organ needs to survive, which is why your body pumps all the blood to your heart. making you feel queasy. I'm going to feel sick. I'm going to feel sick. Lightheaded, sweaty palms, jelly-legged. Okay, so all of these are symptoms of anxiety that you may have experienced over time. When your heart's racing, don't know whether you want to stay in, go out. That confusion of if you're outside, I want to go back home. When you're at home, I want to go back outside. So it trips us all the time. In terms of all of these symptoms, knowing that this is happening so quickly, we get into that state of panic. Oh my goodness me, I can't breathe. Okay. Bringing ourselves back into 2020, knowing that the whole world now is struggling with anxiety. So almost the world has a window into your view of the world. With that pandemic, with the COVID, with all of that in terms of not knowing how to be out there. This is an unnatural world. So actually, anxieties you will see in the whole population right now. Everyone is experiencing anxieties because the world is so uncertain. For yourselves, specifically with the cancer, the world is uncertain for a different reason, because you have been diagnosed with this life-threatening illness. Bringing ourselves back to 2020, we don't have those beasts, dinosaurs, saber-toothed tiger, but now in the general world we have COVID, we have coronavirus, which we hadn't heard of a year ago. Everyone is responding with anxiety. The population has been responding with anxiety, not knowing how to be because the world is so uncertain. That's been you for a long time, since the diagnosis, because the world is uncertain. So your mind's eye has been looking out for threats of all sorts related to cancer. For yourself, knowing that there have been cancer billboards, cancer adverts, you may have been flicking through magazines, and again your mind's eye seeks out that cancer story. You may be flicking the channels and there's a cancer story. Newspapers, there's a cancer story. So almost your mind's eye, it has still got that heightened state of alertness. It has this because it's your safety mechanism. This is your mind's eye from prehistoric days looking out for threats. So it's instigating that same fight or flight, running as fast as I can or fighting as hard as I can, and being almost trapped between the two, not knowing how to be, or that freeze and just feeling very numb to all of this. Your mind's eye has been noted to cancer, so almost it's heightened and it's noticing all of these cancer adverts, these cancer stories in the newspapers, in the media. It's everywhere. Sadly, it's been there all the time. It's not targeting you specifically. It's been there all the time. So it is a safety mechanism to make you aware. Your mind's eye is just highlighting it as a red flag to say, cancer, just be aware, just be aware. One way of allowing yourself to normalize this is to say, these have been there all the time. The Macmillan adverts, the cough adverts related to lung cancers have been there historically, always around this time of the year. And the Public Health Authority do run cancer adverts throughout the year, targeting different types of cancers, just to alert Joe public out there who may not be aware of the signs and symptoms. So they've been going on throughout. It's just that your mind's eye is now noticing them even more. If I give you an example, ever bought a car which is just such a different colour, or an item of clothing that you think, haven't seen this, so I will buy this because it's so unusual. Once you've bought it, you go out there, what happens? You notice the same colour everywhere. It's the same principle working with the cancer. It's not targeting you specifically because you've been diagnosed. It's just that your mind's eye is seeking it out so much because it's so important to you at this moment. So it's a safety mechanism and it needs to be there. Do you know the amount of people that I know, patients who've historically said, I wish I could just wipe out this episode of my life. Actually, you don't want to wipe it out because it's your safety mechanism. It's what's keeping you safe, okay, in terms of being aware of the signs, the symptoms, what to look out for. And again, our brains are so developed that it suggested everything that you've ever experienced in terms of sounds, everything you've seen, everything you've heard is recorded at the back of your mind somewhere. So knowing that it's recorded, this is what creates memories. Memories in themselves create these vicious cycles. Okay, so whether you get that brown envelope fall on the doorstep because it's an appointment, or whether you hear the name of your nurse specialist, cancer nurse specialist, triggers all sorts of memories again. It may be those clothes that I know certain patients will say, these are my chemotherapy clothes, or this is where I used to sit in the outpatients appointments. Do you see how quickly your mind's eye becomes associated? This in itself creates all sorts of vicious cycles, creating states of nervousness, states of stresses, states of anxieties, and erodes our self-confidence. So we are constantly in this cycle of anxiety. Okay. Which brings us to recurrence fears. Knowing that your mind's eye has experienced cancer now, and it's trying to safeguard you to the dangers of cancer, it has learned about cancer. So are recurrence fears normal? Absolutely. How can they not be? Because now that your mind's eye has registered cancer and you've experienced treatments, you've experienced the support, possibly the hospital appointments you've had, how life has changed post your diagnosis. All of this has been recorded at the back of your mind. So how can your mind not be fearful of recurrence fears? It has to be. It's just over time, your mind's eye will focus on something different and the recurrence fears will go further back. Right now, it feels very much at the forefront of your mind's eye, which is why they are so heightened. And again, other things that make us much more aware is having lost trust in our body, in the world around us, because cancer was never in our life plans for anyone. Okay, even for people who have a genetic history in terms of cancer running in the families, we never expected it to arrive, so we lose trust in our bodies. But actually, if I then stop and say how many of you did have a subtle symptom, a subtle sign, whether you found the lump yourself or whether you found just some sign that your body was giving you, whether that was the tiredness, the general fatigue, that something wasn't wrong. So actually your body's quite a fantastic machine that has alerted you. And if you are in those rare few groups where cancer was picked up in terms of mammograms and you had no signs, no symptoms, actually it's thinking about how we regain that trust in ourselves, knowing that you will be routinely followed up. And hopefully your cancer team, your cancer nurse specialists will be advising you about what you need to look out for. And in that sense, we need to regain that trust in ourselves. We need to regain that trust in the world, because I'm sure your mind's eye has gone to the why me. Is it the food you ate? Is it those toxins in the environment? Is it, the stresses? The why me question, actually, I will come back to at a later stage. So we do need to regain that trust in the world around us, knowing that we're in a very different world right now anyway, because of the pandemic. So that might be heightening your state of alertness too. Knowing that it's been described, coronavirus has been described as this invisible threat, which doesn't help. But for us, knowing that you can keep yourself as safe as you can, wearing the masks, still going out, and just having fresh air, having a bit of exercise, because you know how important that is for the state of mind. Otherwise, everything about us becomes very internalized in living in these thoughts up here. That isn't life in itself. Life is out there that we need to live. So as much as I'm saying this, I'm very aware of the pandemic and the world that we're living in. It's about keeping yourselves as safe as you can, but still relating with the world outdoors. Okay. Other cues for your mind's eye to become heightened include those body image changes, just the changes in your body. So whether you've been a breast cancer patient and you've had a lumpectomy or a mastectomy, your body has changed. Whether you're a colorectal patient and you've got a bowel cancer diagnosis, so you may have a stoma bag, you may have scars of all sorts. So your body has changed. And again, your mind's eye has known yourself pre-cancer for X amount of decades. It knew what your body was. Now your body has changed. So every time you look at yourself and you see the scars, it may cause anxieties, the fatigue, the tiredness. So every cancer patient, a cancer patient who may, who may have had surgery alone, who may have had surgery, chemotherapy alone, surgery, chemotherapy and radiotherapy, or ongoing treatments. It doesn't matter what treatments you've had. Post-cancer, there will be that level of fatigue, okay? Physical fatigue, which is different to tiredness. So tiredness, our loved ones will experience and will understand, where actually there's just that general tiredness. For you as cancer patients, it's fatigue. It's when the light bulb just goes out and your body just cannot do anymore. So the mind may be willing, but the body absolutely is saying no. Okay, so we do need to listen to our bodies and rest when you need to rest. But as counterintuitive as this is, the historic treatment for fatigue used to be, and our nurse specialists used to say, rest up and relax and regain your energy. There's a bit of truth in that, but there's far more weight, and this may sound counterintuitive, to say actually we do need to do a bit more, because you know what it's like when you sleep and you sleep and you sleep. You want more and more and more sleep. So we need to stretch our bodies a little bit more in terms of doing just gentle exercise, which is why I say we still need to relate to the world outside, keeping ourselves safe with our face masks, but still going outside for a walk and stretching that fatigue a little bit every time. It's like an elastic band. Our bodies, we just need to stretch them a little bit more, okay? Because the amount of times I hear patients say, I wish I was back at my old self. That old self you had built up over decades, okay? And this isn't to say that it's going to take decades, because muscle does have memory too. It's just right now, cancer has unnerved us. And because it's unnerved us and we've lost our confidence, our world has caved in alongside the pandemic. We do need to stretch it out a little bit more. Okay. Social media stories. So you, again, in terms of heightened states of awareness, doesn't help when celebrities are out there speaking about their own cancer diagnosis. And again, with celebrities, you will find they will either be talking about how they've conquered it and how well they've done, or they'll be talking about the other extreme of how difficult it's been with the very poor prognosis. Rarely do you have celebrities in the middle saying, actually, yeah, we're doing this, we're living with and beyond cancer, which is where I would say majority of cancer patients are, learning to live with and beyond cancer. Okay. So I've spoken already in terms of that mind's eye being heightened to that cancer and seeking it out everywhere. It's that cancer antennae. Flicking the newspaper, so you will see celebrities talking about their cancer diagnosis, either of those extremes. You will have friends who want to relate with you, who when you say you've been diagnosed, we'll pull out whatever old story, new story they have about the cancer. And I know so-and-so who was diagnosed, and I know so-and-so, and it didn't go so well for them. Really difficult, because they're trying to relate to you with your diagnosis and will pull out the most irrelevant information. So now it's worth thinking about how we relate with our friends by giving them very clear guidance when you tell them about your diagnosis, okay? Whether you say, yes, I've been diagnosed with, and you know, I'm doing really well, I'm living with and beyond. Just by saying a bit more, it will hopefully stop them from pulling out that irrelevant information to relate with you, or give them very clear direction. I appreciate you might be struggling with this yourself, but let me tell you, I'm doing okay with it. So this is where you will learn who your friends and family are. Those who will back away completely because they don't know what to say, or those who will check in on you every now and then, even if it is to say, I don't know what to say, I don't know how to help, but I just want you to know that I'm here. So I know, I appreciate I'm giving you a lot of information right now. If you want, stop the video for a while and come back to it, or I will carry on. Just take this at your own pace. Something else I talk about a lot is anniversaries and markers that we have. So knowing from a very young age, you've been shaped, okay? Historically, you've been shaped to say, remember my birthday, remember your birthday, remember my anniversary, your anniversary, whatever anniversaries there are. Now we've had a cancer diagnosis. So if I said date of diagnosis, start of treatment, end of treatment, all of these dates will come to you like this, because your mind's eye has recorded them, okay? They're there at the back of your mind. It just comes so naturally because your mind's eye has logged them. So if you take away nothing from this recording, from this session, just make sure you mark those anniversaries, whether that's a date of diagnosis, start of treatment, end of treatment. And when I say mark those dates, those anniversaries, you know, some people will jump up with joy and, you know, will make big things about these anniversaries. You know, whether they do the marathons, climb the mountains, whatever it is in the pre-pandemic world. If you are a person who's reserved, actually just note it in your mind's eye to say, yep, I know what date it is. Whether it's with your loved one, and just say, yeah, do you know what date it is today? It's been a year, it's been 2 years. Name it, voice it out aloud. If you don't, your body will seep it out, okay? Because it's recognized something that goes unacknowledged. So please acknowledge it to yourselves or to somebody. Other issues that raise that heightened sense of alertness is your role has changed. So whether the role changes from being a mom, from being an employee, from being an active person, a person who used to look after others, I used to do the babysitting, whatever it was, you've had a multitude of roles pre-cancer. When you get diagnosed, the most significant role becomes the patient role, okay? This is where loved ones, as best meaning as they are, will take all your roles off you. So don't do the cooking, don't do the cleaning, just get well, just focus on you. And you know, that helps initially. Over time, it doesn't. So knowing that we would do this in a group setting, I would often suggest that patients bring their loved ones, because this is a message I would say to loved ones. Please hand back some of those roles, even if it is the vacuuming, the gentle cleaning around. All of this we need to reclaim so that we are much more than the patient role that we had to carry, but the patient role has to be time limited. We need to pick up our other roles. And that's not to say that you need to do the vacuuming. If you don't like that, then actually hand that over. But You know what I mean, okay? Please reclaim some of those roles. Have that assertive conversation to say, with loved ones, to say, I appreciate you've wanted to look after me, but now I feel stronger. I want some of those roles back. Okay. Those ongoing hospital appointments don't help because, again, they will keep triggering that heightened state of alertness. And this is where a lot of patients, it's that double-edged sword in terms of I want to scan, I want to know what's going on. To then, as you lead up to the scans, that anxiety goes through the roof, let alone waiting for the results. Okay, it is such a double-edged sword because this is where I say we need to regain trust in ourselves. If you do have hospital appointments, please do keep them. If you don't have them and you feel like, oh, no one's checking in on me because of the way the world has changed, this is where I would say, and this is where in the group we would always have clinical nurse specialists reaffirming, if they don't contact you and you are worried, please pick the phone up to them. That's what their role is, to support you. Doesn't matter how long post-treatment, post-diagnosis, if you're struggling with something, please pick the phone up and speak with them, okay? That's not to say that they will respond immediately because they will be out on the wards, they will be supporting other patients. They will get back to you eventually, knowing that some of our teams are quite small, so they are stretched. That's not to say that you shouldn't call them. Leave your name, leave your number, because the amount of times we receive messages to say, hi, I'm struggling with, can you call me back? You need to leave your name, you need to leave your number. Please contact your nurse specialist should you need to. Also recognize hospital appointments are a natural state of anxiety-provoking appointments. Hospitals are not normal, okay? Knowing pre-cancer, if you had a hospital appointment, you would have been anxious anyway. Okay, so allow yourself to experience that normal state of anxiety. Should you have a hospital appointment, one of the best ways when you are leading up to an appointment, just keep yourself distracted, okay? Whether that's being with loved ones, whether that's just voicing it to say, I've got that appointment, I'm quite worried about it, but this time next week it will be done and I will know what that appointment was for, okay? So just keep yourself focused, distracted, but also related with loved ones around you. So we are learning to live with uncertainties. So is Joe Blogs right now with the pandemic. So, this is where I say now people who don't have cancer almost have a window of what it is like to live with uncertainties. So now this will hopefully normalize that state of anxiety for you, that everyone has anxiety. But for yourselves with cancer, we are having to learn to live with anxieties. We are having to learn to make meaning. Your mind's eye post-cancer, as soon as you will have been diagnosed, will go to the why me, and it will desperately be trying to make sense of, was it the food I ate? Was it what I drank? Was it the stress I experienced? Do you know, as much as we are so far evolved now in terms of the cancer world with treatments, we don't have definitive causes aside from a few, okay? Which is why you will see the whole thing about stop smoking, limit your alcohol intake, keep physically well, think about the weight issue. These are all contributory factors because you know yourself. You will know of other people who will be drinking heavily, who will have the most unhealthiest diet, who will be overweight and not have cancer. So as much as these are contributory factors, these are not the only factors. So there is a lot about cancer we don't know. So we don't know the definitive causes, Because if we knew the definitive causes, we would be so much closer to the cure. Okay, but in between all of this, there are so many more treatments coming along every week, if not every month. You will hear something in the news about the new cancer treatments, whether that's the one blood test. Recently we saw the one blood test that uncovers 50 types of cancers. Do you see, this is all forever emerging. So in that sense, we're in a good place. So we are desperately trying to regain mastery, control over this cancer. Knowing that we are desperately trying to control this, something I often say in the group, or I would say to patients, is we've lived alongside this uncertainty all our lives. So if I ask you a question, what is the meaning of a birthday? Often I will have patients saying, a celebration, the day I was born, a party, a get-together with family and friends. This is where I will say, actually, there's a very morbid way of looking at it. Not something that we often think about, or you may sometimes have thought about it, a year closer to death. But as human beings, we don't do that. We flip it on its head and we say it's a celebration of being with loved ones. Another year older, but we're having fun. Okay, so knowing that we have been living with this fear, this death scenario all our lives, from the moment of birth, only two things in life are guaranteed, aren't they? A birthday and a death day. We choose not to think about that death all the time. The cancer diagnosis has brought it right to the fore. What I would say is, over time, it needs to find its place at the back again, so our focus can go back to hobbies, interests, holidays, loved ones, all of this, before we need to face that death card. Okay? So in that instance, we have been living with this all our lives. It's just that the cancer diagnosis has brought it to the fore. Allow yourselves to put it to the back of your mind when you can. It raises all sorts of existential crisis, existential issues in terms of meaning of life. And I often say cancer patients now have these cancer-tinted lenses. And you know, this is why I love group work, because only cancer patients will be able to say, yeah, the meaning of life has changed. So you no longer are bothered about the queue jumping when you see people jump the queues, about the arguments about so-and-so's not emptied the bins, because there's a bigger picture in life, okay? This is where life has changed. Allow yourself to regain that meaning in terms of what is important to you. And as much as loved ones will have supported you, may have attended all your appointments with you pre-pandemic, been there throughout with you, supported you, do you know, they won't have those cancer-tinted lenses in terms of knowing how the world has changed, knowing how the world view has changed for you. So this is where I would say, actually, if you ask your clinical nurse specialists if they are able to host a support group, hook into that, because again, it will normalize that sense for you. Okay. So we need to plan for the future. It's one of the ways of regaining control. And again, historically, I will see patients who will, because you've been through the cancer diagnosis, yeah, I'm going to book 4 or 5 holidays pre-pandemic as I can, or will pick up living to that extent of I'm doing everything I've ever wanted to do. So you'll have extremes of people wanting to absolutely do the living, or patients who are absolutely stuck and overwhelmed with that anxiety. I wouldn't advocate either of these two extremes. What we want to aim for is middle ground, is to pick up living as best as to our pre-cancer, okay? Picking up some of those roles, allowing yourselves to relax into this a little, knowing that you've got a fantastic army of professionals around you including your oncologist, your clinical nurse specialist, your supportive services, which might be complementary therapists, psychology team, Macmillan Hub. There will be lots of professionals that you may know still around you. Allow yourself to again relax into this, knowing that you've got a range of professionals you can call upon should you feel the need. Okay. Again, the impact on family and friends. It's such a double-edged sword, isn't it? So post-diagnosis, family and friends all will want to cocoon you, and you may have found this, where they take away all your roles and want to do everything for you and can't do enough for you. And you then come to the end of treatment. Well, treatment's gone now. You're fine, get on with it. Or you will have friends say, don't you look great? Almost you want to ping their eyes out, don't you? Because we all wear this mask to say we're doing the best we can. So this is where I would say, allow yourselves to change that conversation from when they ask, how are you? To almost say, do you have time for a coffee? Okay, and quickly you will learn those friends who will say, yeah, absolutely, shall we book it in our diaries? Or those who will say, yeah, I'll call you. And you'll never hear from them again. So it is that double-edged sword, okay? But it's about how we take control of it to almost redefine the how are you. Please don't fall into that automatic response of, I'm fine, thanks. Or, yeah, I'm doing really well. When internally you know you're not. Please let's allow our internal feelings to match what we project out there. So that if you are feeling under the weather, if you are feeling low, people can pick up on it and again support you as best as they can. Okay. Other factors that remind you of this cancer diagnosis is that pain. So again, any of those headaches, that twinge in the shoulder, the backache, will instigate that fear of recurrence. Oh my goodness me, it's back, it's back, it's back. And before you know it, you're there planning your funeral again. Okay? Bring yourselves back. The headache could be because you're staring at the screen so much. The shoulder twinge may be because you may have been gardening and overdone it. So this is where I would say, and I would, again, our CNSs would confirm this, to say, allow yourselves to sit with it as long as you can, whether that's a week, 10 days, 2 weeks maximum, to see if this shifts, if the pain changes. If the pain settles, great. It was something that you pulled a muscle, or it was a normal ache or a pain. If it changes and it gets worse, please pick the phone up to your clinical nurse specialist. And this is, again, I vouch for this because I've worked in Warsaw for 20 years. I've worked alongside our clinical nurse specialists who will, again, reaffirm that it's okay for them to have a 5-minute phone call with you to reassure you, to talk it through with you, than you be sat there for 5 days, 10 days, a month, 2 months, worrying about what this could be. Please pick the phone up should you need to. Okay, so again, these reminders do unnerve us. The scarring I've talked about already in terms of how our body may have changed, and as difficult as it is, it's relearning our body. So a lot of patients will say, I can't look at the scar, I can't look at myself. I will often say, this is the new us. And I know a lot of us will struggle with that new me because we're desperate to have the old me. The core of you hasn't changed. Okay, so it's about how we make meaning of these scars, whether I've heard patients say, this is my badge of honour, that I've done this, that I've survived this. We may not like it, but it's about how we learn to adjust with the new scars that we do have. The fatigue I have spoken about, and again, diet and fatigue go hand in hand. So if you're not eating that well, or if you're not nourishing your body will be tired and you're working against it, again, if you feel that it may be beneficial for you to speak to one of our cancer dietitians, please pick the phone up to your cancer nurse specialist, who will absolutely refer you to the dietitians who will go through your diet with you. Okay. Sleep changes. So whether we sleep too much or we have that unrested sleep because the mind just won't switch off. Okay, if these are struggles for you, again, please let one of us know. What I would say is, again, this goes hand in hand with caffeine intake, and often we forget in terms of the stimulants that you might be taking. That doesn't just necessarily mean drugs that you're taking or substances that you may be taking. Thinking about the alcohol that you may be drinking, thinking about, even if it is hot chocolates, it may have caffeine within it. Some people are so used to having a tea or coffee before bed. That may have worked historically for you. It may need reevaluating again. If that weight gain, weight loss is a concern, please think about having a consultation with the cancer dietitians. We do have cancer dietitians specifically for that reason. Macmillan do some fantastic booklets on a building up diet, okay, and a general booklet for healthy eating. Again, if this is something that is of interest to you, have a look on the Macmillan site. Please steer away from Dr. Google. You do not need to be Googling anything. Macmillan site, I would absolutely advocate. Otherwise, please speak with your clinical nurse specialist, or if you're at the Manor Hospital, speak to Kaz Kaur at the Macmillan Hub, who manages the Macmillan Hub there and who has all the booklets there. Okay, so she will almost signpost you to the most relevant booklet that you may find some benefits from. Sexual relationships is something that often doesn't get spoken about, okay? Knowing that this is, or pre-cancer, may have been a very important role for a lot of couples. If this is something that you are struggling with in terms of loss of libido for men, erectile difficulties for women, the vaginal dryness, please, again, speak to your clinical nurse specialist, because in Warsaw we do have a sexual health counsellor. Yes, she is part-time, she's very limited, but again, we have access to the relevant professionals. So should you need to, we can refer you to the sexual health counsellor too. We may need to reevaluate our goals in life, knowing that our body has changed so significantly, knowing that we are having to learn to live with this fatigue, knowing that cancer has changed our meaning of life. Okay, what I would say is, don't reevaluate life just by yourself internally in your own thoughts. Please speak to loved ones, because one thing I will say with cancer is, if you keep it in here and make changes, it will either break families or it will absolutely make families. Okay, so please talk openly with loved ones in terms of what's going on with your thoughts, to reevaluate those goals in life. And we often say, oh, I'm just feeling so depressed. This is where I would say, learn the distinction between sadness, upset and depression. So I would often ask, do you know the difference between sadness and depression, knowing that the words get used so interchangeably? So remember, sadness is being able to look to the future, possibly with tears in your eyes, and that's okay. It's sadness, it will lift. With depression, we just may not be able to think about the future. It's almost being paralyzed in this instance, not being able to think about the future at all. Okay. If you are struggling with depression, please seek help sooner rather than later. It's easier for us to work with you whilst you're spiraling than when you become rock bottom. Okay, and this is where I would say, please also seek help from your GP. And as much as I will have patients saying, no, do not want to do antidepressants, don't want to do any more medication, do you know, antidepressants and talking therapies go hand in hand. Sometimes, because of the cancer, our chemical makeup in our body may be skewed. You may just need a little bit of a top up so that we can function at our normal rate again. Please seek help, whether that's for the anxiety meds or the depression meds. It's also thinking about that mixed bag of emotion, whether that's sadness, depression, whether that's that anger and that sense of unjustness. Okay? Anger at self, and I can't do what I used to be able to do. Anger at others because they don't understand, or at the world because how dare we go through this cancer alongside the pandemic. Absolutely all of these emotions are valid, are justified. Please don't get stuck in any of these emotions. Let's learn to acknowledge them, not battle with them, and see if we can move forwards, acknowledging them, but almost allowing them to be. And I'll talk to you a little bit more about how we can do that. Do you know, we struggle historically with all of these stigmas, with all of these labels, because we've been living with these taken for granted rules. Almost rules that state that if I'm not healthy and I'm not happy, then I'm not normal. Do you know, I would really question that, knowing that the single most remarkable fact about human existence is how hard it is for human beings to be happy, because the goalposts keep shifting all the time, don't they? So if I talk to you a bit more about this in terms of why the goalposts keep shifting. In our culture, our learning style has always been striving for ideals. So you know from a very young age, go to school, make a lot of friends, that will make you happy. Pass your exams, that will make you happy. Get your A levels, get your university degree, that will make you happy. Get a good job, that will make you happy. Get married, have kids, that will make you happy. The goalposts are forever shifting, okay? Do you know, I often say happiness is not the goal in itself. Happiness is almost a direction. We headed that way, i.e. we headed west. The goals are the markers that we headed west. So we might climb a mountain, we might go to a beach, we might go to a coffee shop, we might go to a restaurant. These are the goals that keep us headed west, and that keeps us happy. Please don't assume these goals in themselves make us happy, as long as we headed in the right direction. We're made like this, we're shaped like this because of our associations of the rules that we've historically lived by. Rules that we've been brought up from a very young age, i.e. don't touch the radiator, you'll get burned, don't talk to strangers, it's dangerous, don't eat things from the floor, you'll make yourself poorly. For me, don't go to dentists, it will hurt, don't go towards big dogs, they'll bite. Now your mind's eye knows about cancer. Now that you've got cancer, you'll get recurrence. It's just your mind's eye trying to work alongside these rules and associations that it's always had. It's about how we break that association and create a rule for ourselves to say, yes, I've had cancer, but I'm in the best place possible. I've got my army of professionals around me. I'm in the best place I can be. Okay. And again, historically, we've learned to use worry as a coping strategy. You know that saying, when we have nothing else to worry about, we worry about why we don't have anything else to worry about. Almost it's about how we break that chain of cycle. And it's always in the still of the night that worries catch up with you. Because in the daytime, we are so good at keeping ourselves distracted, keeping ourselves focused onto other things, that in the still of the night, the most worrisome thoughts will catch your eye and will make you aware of what's been bothering you. And that in itself sets up cycles, because then we worry about not having had enough sleep, and because I've not had enough sleep, I'll wake up tired, and then I'll feel really anxious, and then I won't want to talk to anyone, and then I'll be even more worried. Do you see? The cycle just goes on. And this is why I say, what's the worst thing that happens with lack of sleep? Yeah, we might be tired, we might be groggy, but you know, we all function. We all survive the best we can. Okay, you might be drinking a few more cups of coffee, but you will get through the day again. We just do. We don't collapse out of tiredness, or you might have a nap in the daytime. Talking about naps, a really good way of having a nap and still feeling energized, a trick that I've learned from our dietitians, is not too close to bedtime, but again, mid-afternoon or early morning. If you've not had a good sleep, have a strong cup of coffee or tea. Allow yourselves then to have a nap for 20 minutes, 40 minutes maximum, knowing that we have a sleep cycle. So you will dip it into a sleep for 20, 40 minutes. But if you sleep more than that, you will go into a deeper sleep, after which you won't want to wake up. So 20, 40 minute cycle is just enough. And when you do wake, then the caffeine will have kicked in with a zing in your step. So hopefully that might help. So other ways of managing is, because we have this problem-solving mind, we're desperately trying to find meaning, and we're battling with our thoughts. Please, can we allow our thoughts just to be? They're just random synapses that are doing this. Let me play you this YouTube clip. And it's a fantastic clip that explains what it's like having all these thoughts in our mind's eye, almost like passengers getting on a bus which you are trying to steer. We can't do anything about these passengers constantly nattering. If we listen to them, we lose focus of where we're headed. If we allow the passengers just to natter away, almost it just becomes that diluted noise in the background, like our thoughts, as long as we keep going forward. So let me play you this video, and that might help make sense of what I'm saying.
I'm Tom. This is the story of my bus of life. On the journey, I pick up lots of passengers, memories, thoughts, emotions, some pleasant, some not so pleasant. Sometimes handling them can be tricky.
I knew you'd come this way again. Same old, same old.
You're pathetic.
What a grumpy lot. Don't worry, driver, I can sort them out.
Don't even think about going down there.
That way will never work out.
Where's that bus going? It looks exciting.
What do you think you're doing? You think you have what it takes? You'll just fail like last time. Dream on.
What's the point? It's too much work. Why take the risk?
Haha, it's not like it's your choice. This is my bus.
Okay, I'll turn around. Just be quiet.
Listen, let's make a secret deal. You keep doing what you're doing and I'll keep the passengers quiet for you.
Okay then, back to the same old road. Just so you know, I'm not happy about this. I like driving buses, But what I'd really love to do is be a race driver.
Loser, what do you think you're doing?
Better stick to what you know, or the deal is off.
Race driver? You're a loser. Stick to driving buses.
Right, that's it. This is my bus. Get off.
Yeah, fight me. Let's see where that gets you. You pathetic excuse for a driver.
Your bus ain't going anywhere now. I don't know why you bother driving.
Hey, what's going on in that bus? Things seem to be happening differently.
You're not allowed to go that way. We've got rules.
Thanks for the feedback, guys, but this is my bus.
Maybe I don't need to get rid of this bunch. They could just come with me for the ride.
Whatever, you're still a loser.
I don't know about this.
No, what about the deal?
Racetrack, that's where I want to go.
See, we told you. What were you thinking?
You could never be a racing driver. Just play it safe.
Hang on tight, guys. Here we go!
So, from that, you may have learnt that we can choose our route, but we don't need to get into a battle trying to choose those passengers or trying to choose those thoughts. Thoughts are just thoughts. Do you know, and I really struggle when people or patients say, I have to be positive. My goodness me, thoughts are just random thoughts. They're not positive thoughts, they're just not negative thoughts. It's the associations we make with them. So almost with thoughts, I would say, can we imagine almost a carousel going round and round and round? Like when we go on holiday, in the olden days when we used to go on holidays, there'd be loads and loads of bags on that carousel. Now we have a very bright red bag, which is, for us right now, a bag full of cancer stuff. Whether that's fears, anxieties, whatever it is. It's going round and round, but in our carousel, in our mind's eye, this is the only focus. The red bag keeps taking our focus. And we start unpacking it. I don't want to think it. I don't want to think it. And we're unpacking it all the time. Instead of unpacking it, can we put that red bag back on the carousel and allow it just to go round and round along with all the other thoughts? It may fall off at some times. It may reappear at other times. As long as we're not getting stuck in it and unpacking it, just allowing it to be. Okay. Another way, another analogy, I like analogies because they stay with you, is would you ever get on a bus or on a train where you didn't know what the destination was? Would you ever get on board? And when I ask this question, hopefully most people will say no. Sometimes rare few who've said yeah, because it'd be exciting. Okay, as long as the aim is excitement. Often, for majority of people, they will say no because it's dangerous. We don't know where we might end up. So why in the still of the night do we hook onto this train of thoughts that go by? And it is a train of thoughts that go by because it has images of our loved ones, things that are of importance to us. We jump on board and then we battle with ourselves to say, I don't want to think this, I don't want to think this, this is a worst case scenario. It will always be the worst case scenario because this is that train of thought. So instead of jumping on board of that train of thought, can we just learn to observe that train to say, yeah, I'm not going to jump on board, but this is the mind's eye of train of thoughts just whizzing by. I'm just going to allow myself to watch it remotely, almost like watching a film play back. And in that way, not becoming those thoughts, just learning to observe those thoughts. And I often show this photo, and I have to change this photo because I don't think our youngsters will know what this means. So if I ask, what is this photo of? It's of a man sinking in quicksand. And I would often ask, what should you do in quicksand? It's often to stay still. What happens when you battle, when you're sinking in quicksand? You sink some more. So the urge is often to fix, to avoid, to get rid of things that we struggle with unpleasant emotions. Can we just sit and stay still with them and allow them to pass? Do you know there's a fantastic advert that's recently been played over the months from the RNLI of what you should do when you find yourself, hopefully not, but when you find yourself falling into cold water. Learning to float and not battle. Because when you battle, you're using your energies of thrashing around. And instead, can we just float until help comes? In the same respects, can we just allow our emotions to be? Let's not battle with that anger. Let's not battle with that depression. Let's not battle with that anxiety. Can we just keep focused in terms of doing what we need to do? When we battle with all of these emotions, that magnifying glass turns internally and it paralyzes us from doing the living. When we stop battling, at least we can function with what we need to do and just being with the loved ones that we need to be around. So we often find ourselves in difficulties when we push against our experiences. The what if this happens, what if that happens? That's your mind's eye forecasting the future because it doesn't know the future. It will always be a what if because we don't have a crystal ball. We never have had that. And it only knows history. History right now has been difficult, so can we allow ourselves to be in this moment, present moment awareness? We are safe, we are fine. The goal of today is, and allow ourselves to function. It's when we avoid things that it erodes our self-confidence. So I can't meet with, loved ones or go to that party pre-pandemic, I know, or meet with those friends that I used to. The more we avoid things, the more we lose our confidence. We can't buy confidence at Sainsbury's, at Waitrose, at any of these supermarkets. Historically, we only had confidence because we took these risks and we didn't avoid the difficult feelings. We learned to tolerate them. We struggle when we argue with ourselves internally. There's that battle, isn't there? I shouldn't be thinking this, I should be doing that, I ought to be doing this, I could be doing that. Can we break free of those shackles and just say, what is the best I can do right now? Even if it is, let me just move this from there. That feels better, I've done that today. We struggle when we anticipate future bad events. Because we've had cancer, almost your mind's eye is forecasting the future to be just so much more difficult. All the treatment issues will settle over time. And if they don't, we will learn to manage alongside them over time. So can we cut ourselves some slack here and just allow ourselves just to be in this instance? Let's stop reviewing past bad events. The past is gone. It doesn't dictate the future. It's just this moment, here and now. It's when we listen to our long-standing rules about what we should, could, and ought to be doing. Let's not focus on that. Let's allow ourselves to just be in the here and now. So we need to learn some psychological flexibility. Life means thoughts and emotions will show up because that's just what the human mind does. That's how it's learned. That's how it's worked historically. We've always had thoughts and emotions. We can't get rid of them. Some thoughts and emotions are unpleasant, but in themselves they are not harmful. They're just thoughts. They don't dictate our behavior. It's only when we lose ourselves in them that we become paralyzed by them. If we allow them to evaporate, they will disappear. Almost imagine placing them on clouds and just watching them drift by. Okay. We have a natural urge to fix, to get rid of, and to avoid things. Can we just allow ourselves to learn to tolerate that uncomfortableness, knowing it will shift, because that's what emotions are. They are fluid. They will not paralyze you unless you are focusing on them 24/7. Allow them to arrive. Shake yourself off. Look outside the window. It's a fantastic way of something different taking your attention, whether that's a bird, whether that's a passerby, whether that's just nature in terms of what the weather is doing. It just switches the mind's eye to focus on something different. So the goal is not to get rid of the thoughts or the feelings, but to enable you to do things in the presence of these thoughts and emotions and make the most of the experiences that matter to you, so that you are able to live a rich, full, and meaningful life that you choose to, knowing that these thoughts and emotions will be there because they've always been there. There's not a single person on earth who doesn't have thoughts and emotions. So, what has avoiding these thoughts and emotions cost you so far? It's given us that impression that we are in control. But we're not in control of our thoughts and emotions. We're desperately trying to bury them. So if I give you that image, and again, I like images because imagine we're trying to suppress that ball in some water, really hold it down, suppress all those thoughts, images, like a ball floating in water, and we're trying to push it down. What happens when you let go? It goes smack in the face. Can we not suppress thoughts and emotions? If you allow that ball to float in water, it may arrive and take your attention. Sometimes it may drift away at other times. It may arrive at other times again. But in that respect, you don't get stuck. Okay? And thoughts and images are really interesting because, if I said to you, don't think of a pink elephant. Nowhere in the world will you see a pink elephant. That would just be a silly thing to do. What does your mind's eye do? It will create a pink elephant. The more you say to yourself, don't think cancer, you shouldn't be thinking about cancer, shouldn't be thinking about anxieties, it will flag it up, okay? Whereas if I said somewhere in the world there is a pink elephant, you say, shit, it's a bit balmy, but whatever floats a boat, and you wouldn't give me a second looking. In the same respect, can we allow our thoughts and emotions just to be? They will arrive, they will disappear, they will take your attention again. Let's not battle with them. Okay. The problem is not the problem, it's a solution we apply by trying to push things away, by avoiding things. Can we just be a bit kind to ourselves and just allow ourselves just to be, knowing that thoughts and emotions are meant to be there? We can't get rid of them. Allow them just to be, to drift, to take our attention sometimes, not for too long, because you can direct your focus of attention again to something that's meaningful to you. Again, we often try and avoid it because we're fearful of the what if. Remember, you are supported by your army of professionals around you. Okay. Often the solution applied is a problem by not engaging in things that we've enjoyed of old and taking time and taking those risks, because that's how we build our self-confidence. So please, can we pick up life again by enjoying, or at least trying to enjoy, things that we used to of old, trying to do things that we used to of old. We need to regain our values. If cancer has become a zombie that you're constantly looking back and running away from, you're not looking forward. You're missing where you are. Okay, so can we stop looking back? Because the future is in front of you and we need to be focused. If you're forever focusing on the rear view mirror or on the side mirror, you're focusing your attention on the past again and you're missing the present, let alone the future. So we need to move forwards with purpose, with focus. Okay. In planning to move forwards, don't go too far into the future, because the future will mean that you will miss what's right in front of us again. So if you're focusing all your attention in terms of getting there and avoiding the past, you're absolutely missing present moment awareness. Let me play you this other YouTube clip, which is fantastic in making the point.
All day long, humans are doing things. We're always doing something, even if it's just sleeping, we're always doing something. And we can broadly classify what humans do into two large groups of behavior. We can talk about towards moves. We're doing things where we're acting in line with our values, behaving like the sort of person we want to be, acting effectively, doing things that help to make life better. Or we're doing away moves, moving away from our values, behaving unlike the person we want to be, acting ineffectively, doing things that don't improve life or make it worse. And what we're aiming to do in this course is give you a lot more choice so that you can choose to do more towards moves. The more you choose towards moves, the richer, fuller, and more meaningful your life is likely to become. The more effective you are likely to become at creating the sort of life and achieving the sorts of goals you want to achieve. Now, what happens is that in a challenging situation, difficult thoughts and feelings show up for us. And when we get hooked by those difficult thoughts and feelings, we tend to start doing away moves. Difficult thoughts and feelings might include depression, anxiety, stress, pain, suffering, fear, anger, guilt, really, thoughts about not being good enough, thoughts about failing or screwing it up, a whole range of difficult thoughts, feelings, emotions, memories, urges, sensations. When we get hooked by this stuff, typically our default setting is we get pulled away from our values and we start acting ineffectively. And so what I'm aiming to do in this course is give you a lot more choice so that when you're in those challenging situations, whether it's relationship issues, health issues, financial issues, work issues, whatever those challenges are for you, when those difficult thoughts and feelings are showing up for you, I want you to be able to unhook yourself from those thoughts and feelings and make a choice, a wise choice, a choice that you decide as wise. I want you to have the freedom to choose towards moves if that's what you want to do. So to do that, I'm going to introduce you to a bunch of helpers that are going to help you to unhook from the difficult thoughts and feelings. And those helpers fall into two categories. Firstly, there's values, so we're going to spend a lot of time clarifying what values are and using those values to set goals and create action plans and guide what you do in this life as you move forwards in the face of your challenges and difficulties. And we're going to be learning mindfulness skills. Skills that help you to unhook from difficult thoughts and feelings and refocus your attention on what's important and engage fully in your life and live in the present moment and make the most of this moment of life as it is right here, right now.
So I hope that helps in terms of clarifying some of the towards moves. You may have heard of mindfulness, and again, I'm not covering that here today. It is a really good thing to get into, so I would advocate downloading apps such as Headspace, Buddhify, Calm. There's numerous ones of these. Try some of them. It may help to concentrate the mind to focus just on the here and now. That's the whole purpose of some of these adult colouring books, because it helps us to focus on the here and now and block out some of those worrisome thoughts about the future and the past. Other ways of managing and other coping strategies are striving for your values. So again, the YouTube clip talked about your values. What is it that is so important to you? Because we need to regain our values, what it is that's meaningful to you. In terms of fatigue, I've talked about that already. What is it that you need to do versus what is it that you want to do? So in terms of fatigue, giving you very little amount of time in terms of that energy that you may have, you may want to think about what it is that you want to do versus what it is that you need to do. I would always advocate making some time for all of those things that you want to do, because what you need to do might be a pile of ironing. And that's not to say don't do the ironing, it's just to say, can we make more room for what it is that you want to do? Another good way of thinking about fatigue is always thinking about it as being a money jar where you're always saving some in the background, okay? So don't ever deplete yourself so much that there's nothing left in reserve. There always has to be something left in reserve, so that if something does come up in life that needs your attention, that needs your focus, you've got a bit of oomph left to attend to it, rather than beat yourself up even more to say, and I can't do this, because there's just absolutely no energy left. Think about pacing and doing things in bite-sized chunks. So rather than doing all the ironing today, can we just do a little bit at a time throughout the day? Yeah, it may extend things, and it's not our pre-cancer norm, because historically you would have rushed around, done everything in a day. Our bodies are still recuperating, recovering. So can we just learn, almost like I mentioned before, we need to stretch ourselves gently. And we will learn over time to stretch ourselves so far so that we can do more than we can right now. I can't stress enough the importance of diet and physical activities. Diet, in terms of good nutrition, is really important. So please do have a look at some of those Macmillan booklets, as is physical activities. And physical activities doesn't mean going to the gym and putting the Lycra on and all of this. It's just even if you stand whilst you're watching TV, going up and down the stairs whilst there's a break from your favourite programme. You know, majority of the equipment that you would have in a gym, you've got in your own home, whether that's the stairs, whether that's a can of beans, or just trying to lift just a bit more, a few more heavy weights at home. Please don't overdo it. But again, if you want some more information, Macmillan have a fantastic exercise DVD as well that you can do in your own homes. So I would absolutely advocate that too. Think about distraction. Distraction works wonders for a lot of people, as does relaxation. So what is it of old that you used to enjoy doing? And can we try some of those habits again? Mindfulness, I've spoken about very briefly, is about being in the present moment. So this is where your mind's eye only knows history. It will panic and become anxious about the future. So it's this moment, present moment awareness. And yes, we often think of mindfulness in terms of sitting in a Zen-like state. Unless you're doing a formal course on mindfulness, it doesn't need to be that at all. Think about using your 5 senses when you eat something. Really, really savor it and really taste it. When you see something, really see it. So, I often say to patients, pick up a leaf and really, really study it. The veins it has, the texture, the shape it has. Really see it for what it really is. Sit in the garden and really notice the birds. Really hear them. See if you can identify if they come from the same group of family in terms of the birds. Think about the smell. So when you're drinking whatever drink you're drinking or eating, really see if you can smell it. Okay, so use all your 5 senses, including texture and what you can feel. We can use all of these just to ground us in the here and now. Please, please allow yourself to plan for the future. I know it's difficult in the current state of the world in terms of not being able to book holidays and stuff, but allow yourself to plan, even if it is the next meal, whether that's Christmas, whether that's Easter. Allow yourself to plan just a little bit into the future, week by week, whether that's fortnightly to then go monthly, because this is how your mind's eye has been shaped of old. Allow yourself to be in the present moment, but also allow yourself to have some nice things to look forward to. And like I mentioned about sexual relationships, if this is of concern to you, please, please let your clinical nurse specialist know so that she can refer you, or he can refer you accordingly to the sexual health counsellors. Do you know some other questions for when you have those unhelpful thoughts? It's just asking yourself, is this thought in any way helpful or unhelpful? If it's unhelpful, allow it to be, allow it to disappear. Is this an old story, an old narrative of yours? Probably is. If it is, you don't need to listen to it again. What would you get from buying into this story that your mind's eye is telling you? Often you would get very little resource that works for you. If you get nothing useful, allow it to be. Don't engage. Focus your attention on something that is going to be resourceful to you. Could this be helpful, or is this just your mind's eye babbling on? Often it will be just that. It's just babbling on. It's just nonsense thoughts in the background. Allow them to be. And are you going to trust your mind, or are you going to trust your experience? I would wholeheartedly suggest you trust your experience in the here and now. Thank you for your attention. I appreciate this has been a lot to absorb. Like I said, historically we would have done this in a group setting. It would have been more broken up. If this helps, allow yourself to again rewatch it as and when you can, to take in what you can, knowing that you've got the recording at hand. If you have any questions, concerns, thoughts, please don't hesitate to voice them to your clinical nurse specialist. Okay. I hope this helps. Please can I urge you to again attend all your hospital appointments as and when you need to liaise with your clinical nurse specialists, to use them when you need to, regain that trust in the army of professionals around you. And I completely appreciate that sometimes we don't gel with everyone. As long as there is one member of staff that you gel with from your army, that's fine. Take care, and I hope that I might meet some of you in person at some point in the future. Thank you.